All right. Hello, everybody, and welcome to the second session of MM&M Convene. My name is Larry Dobrow, and I'm MM&M's senior editor. I drew one of the long straws today. I get to host with Paul LeVine, who is SVP of Corporate Strategy, Data, and Analytics at TrialCard. I get to host patient engagement during a pandemic. Obviously, there is a whole new normal that's been created over the last couple of months, and Paul's going to help walk us through it. But before we get started, you can ask questions at any point during this, and we can field a bunch of them at the end of the presentation. So for now, Paul, thanks so much for doing this today. How you doing?
I'm doing well, Larry. Good to see you again. How are you?
And we actually can see each other this time. It's not one of these audio-only things. So that's
indeed
kind of cool. So Paul, as a first question, your background, I think when we were talking the other day, you said, I'm a public health guy. Given that background, how do you think that's informed your approach and TrialCard's approach to what we've seen over the last couple of months with COVID-19?
It's a great question. In many ways, what we're experiencing right now is exactly what people with my kind of background and training or have studied in the past or used to taking a look at. We've been very fortunate, I would say, in our country as not having to have dealt with something as severe as this COVID-19 pandemic for very, very long time. Probably the only things that could in the near past even come close to this is probably the HIV epidemic that was happening in the 80s and 90s, and probably polio before that. So we've been fortunate that we haven't had to deal with anything like that since then. For us, though, I think right now, the key piece of this is that viruses are notoriously unpredictable. And if you have paid any attention to some of the discussions about what we can expect as a country moving forward from where we are right now, there's a lot of uncertainty about that. And there's good reason for it, because some of the models would indicate that you would see increases that are far worse than what we've experienced so far come the fall. That would replicate what happened in 1918 with the Spanish flu. Others would see a series of rolling peaks and valleys. So I think the bottom line is that it's making us be very humble in our understanding of how powerful this is, and therefore as a company to be very responsive to the needs of our clients. Different needs are required at a time like this. And I'll just give you a couple of examples of that. It's very possible that because of the economic disruption that COVID-19 has created with the number of people who are now unemployed, that the standards and the expectations of where patients get incredibly responsive to the price of medications may get lowered. That means that business rules for a company like TrialCard, where we may be dealing with copay offers and things of that sort, the business rules may have to be adapted to that to make sure that patients can get the medications that they need. It may also come out in the fact that certain products that would require a direct visit from a doctor are not happening because they're considered a little bit more elective. That also will reduce the possibility of allowing patients to get the different meds that they need. So it's these types of things that we're looking at as a company and thinking about how do we look at the set of services that we can offer to our clients and how do we expand them as necessary, as long as they're very reasonable within our purview.
Right. Actually, the next question I have builds on that. We're a few months into the pandemic now. In terms of some of the trends that we're seeing, has it played out the way that you and TrialCard has expected? Has it accelerated trends that we were already seeing, whether it's around telemedicine or anything else?
I think it really has. I mean, we've seen for quite some time, for a number of years, a real focus on digital health. And issues of that sort. How do you connect patients better with digital tools? What can that help as far as our giving our customers a better channel to interact with their customers, their patients? And I think we've all been a little bit frustrated, quite honestly, to see how slow the transition to a more fully engaged digital health world has happened. I think that right now, and this is just an unfortunate thing, because I certainly don't mean to be whistling on people's graves, because I know how it can sound that way, but the reality is digital health is crucial now. These tools that we have looked to for the past several years as having great potential now have significant meaning for patients. It is the time for digital health tools to really come to the fore, to aid patients getting back in touch with their doctors through telehealth and telemedicine approaches, to connect with communities who are experiencing the same types of maladies as they may be experiencing, and also to be able to get the kinds of offers in a very practical way that TrialCard thinks about, as far as making sure that a copay offer is available to that patient through these digital means. And I would love to say that we were in some sense planning for this exactly, but we recently purchased Mango Health at the end of last year, and our timing with getting Mango sort of within the TrialCard infrastructure was incredibly good, because now that is the vehicle that is allowing us to make sure that patients have these types of connections and these types of access to things that right now, because of so many of these issues with relation to COVID-19, that patients aren't being able to get. So in some sense right now, the time is ripe for digital health, unlike any other time I've seen.
It's funny. I was about to ask you about the Mango Health acquisition. Tell me a little bit about it. How has that addition expanded TrialCard's ability to really, to help patients and help clients in a way that maybe you couldn't have before it?
It's a great point. When we looked at the series of services that we had at TrialCard, we have robust copay capabilities, as everybody knows us. We have got very, very significant hub operations, so we're making sure that we can handle the needs of a lot of specialty medications and things like this. But one of the things that we realized was a gap for us was in this digital patient engagement and adherence space. So we looked very, very carefully at the entire landscape to find the best solution that we could see in terms of the technology that was available and in terms of the ability to reach patients most effectively. When we saw Mango, we were extremely pleased with what the offering was, not only because the technology itself was top-notch, but because the Mango folks that we were working with understood how the connection that we could make between those core capabilities of Mango and the services that we're offering on the copay and hub side were in sync in a tremendously helpful way. So for us, so much of what we've really been focused on right now is getting that integration to be as seamless as possible right now, so that patients are able to get their copay cards in the Mango application itself, to be able to track where they are as far as their utilization is concerned, to integrate with all those adherence messages that we were doing using a pretty rudimentary method. Now we're able to do with Mango and incorporate the type of messaging that our customers want to make sure that their customers, that patients can see. All of these things are really possible right now with Mango being integrated into the affordability services that we have at TrialCard. And we're very much looking forward to this next phase, which is probably due to happen within about a month or two, that really will enhance that and go beyond the affordability side into the hub side. And what that will mean is that patients will be able to see where exactly they are in the process of getting their access approved through benefits, investigations and appeals and prior authorizations and all of those features. So, if you think about it, hubs have been really, really effective at making sure that product access really happens very effectively. But one of the things that has been left off in many ways is helping that patient understand really where they are in this process. And that's where we are seeing Mango as having that great opportunity. It's going to give that patient, in some ways, almost like a communicator to understand exactly where they're in their process. And that's why we're so enthusiastic about it.
And yeah, that degree of patient understanding, especially at a time like this when the rug has been pulled out from so many patients, from underneath so many patients. How valuable is that? Is that what patients are looking for, not just in the context of Mango Health, but also in a larger sense, that they want some guidance, some communication, something that basically, kind of reaches a hand out rather than makes them kind of, go and try to find it themselves?
Yeah, so I think what you're talking about in many ways is kind of a curated experience, and I think that's the right way of thinking about it. So what historically has been required of patients is to do that tracking down of information on their own. Because we realized, again, and this was only realistic, and it made sense from the core purpose, especially of what hub operations were all designed to do, is to make sure we could get that insurance authorization so that patient could get on product as quickly as possible. It made sense that was the preeminent concern, and it was the focal point for where we wanted to start in that process. But as I was talking about earlier, to enable that patient to be in on it, to have this visibility into where they are, is equally important. Because when you think about it, really that first experience with a product, especially an expensive product in the specialty arena, that first experience is really almost an administrative experience. So if you can improve that patient experience and make that first administrative experience that benefits, investigation and the PA as positive as possible, you are also creating the first product experience. That's what we're trying to do to make sure that is as optimal as possible. So you're 100% right to present that information, to allow it to be a self-service approach, but to also have it in one place so it's attainable by that patient is critical.
Paul, in terms of that product experience, I think when we were talking about this the other day, you used the phrase unpredictably interrupted to describe one scenario where, businesses are at mercy of waves of, COVID coming back, diminishing, coming back, diminishing. What kind of a solution do companies need to make sure that they're ready for that potential scenario? I mean, obviously everybody would like a vaccine tomorrow, but, that's not realistic right now.
Yeah, this is, I think, one of the key issues. So, like, if you start out most broadly, and then I'll get into the specifics of our industry. But if you imagine what the impact of frequent waves of and recurrences of high numbers of cases coming in, high numbers of deaths from COVID coming in would be, the place where I would least like to be in business is in a restaurant, because the cost of opening up and then having to close down and opening up and having to close down again repeatedly makes it almost impossible for me to consider that. That's the worst case scenario possible. For us, we have the advantage in our industry of being able to see the data as it's coming in, to monitor where our claims activity is coming, and to link that up with the data that we can see in different markets and different communities. I think if there's anything that we've learned from these first few months of COVID is that this, we talk about the United States having 1.4 some million cases of COVID right now, but the reality is that we have got a lot of local outbreaks within the country right now. We have this very, very powerful influence, which is population density. Highly dense locations around the country are suffering the most right now. But the ruthless efficiency of viruses is that viruses will continue to infect until there are no people left to infect. That's just the core of how viruses work. And that's what is so harsh about it. So it puts the onus upon us to keep track of where those outbreaks are happening, to be able to change business rules locally, geographically as necessary. As that economic disruption that I was giving the example of how it might work for people who are working in restaurants or owning restaurants is, it has a comparable analogy for patients who are disrupted and have lost their jobs. With 25 million unemployed people in the United States right now, it's affecting the way that we have understood walkaway rates, for example. So if you think about it, over the years, when I started working very closely in this area, probably about 7 or 8 years ago, we used to use that dollar value of about $35 as that sort of inflection point where we saw increasing amounts of walkaway because of financial reasons. Over the years, that's migrated upwards, probably closer to about $50. The question for me is, because of the economic disruption that we're seeing and having so many people lose their jobs, is that going to force that level of price sensitivity down again? Is it going to be a situation where $35 or $40 to expect a patient to contribute to his medication now becomes too much? Those are the kinds of questions that an organization like TrialCard has to be very, very aware of, and also very aware of with respect to these periodic cyclical waves of outbreaks, because it could mean that the economic disruption is also very local. And so we have to be able to be flexible and very adaptable to changes that could be coming very quickly.
What you said just then about flexibility and adaptability leads right into my next question. How essential is that ability, the ability to pivot? I mean, certainly healthcare has never been known as the most nimble business, right? There are going to be so many mid-course corrections needed. How important is it going to be for companies to kind of get used to that new normal of having to, switch, take their plans that might have been, made over, months and months, and just flip them on their ear at a moment's notice?
I think it becomes sort of the central issue of our time. And if we sort of think about our time as being the next 18 to 24 months in which we can expect to see these regular recurrences of COVID, I'll give you a very specific example from our own company. We very quickly moved from a situation in which our people were coming into the office to be able to be remote. And that ability took really a superhuman effort, but we managed to pull it off thanks to the incredible skills of the people in our leadership and in our IT organizations and our operations to make that available for lots of our employees, because we care desperately that our employees do not get sick. We have to make sure that they're safe and they're protected. And so that's just an example of being able to make a very, very significant change in the way that our operations really are structured in a very, very short time. Now, I think a lot of people, a lot of organizations are being forced into a position where they also have to make their equivalent major changes to adapt to this new reality that we're all in right now. I think it's a little bit easier for a pharma services company like TrialCard to be there than it is for a larger pharmaceutical company. I mean, we kind of have a heritage of being nimble, of being adaptable, of being able to create new opportunities and new services for our clients over time. So much of what we do is fundamentally a virtual service. So how do we as TrialCard look into the other possible needs that our clients may have now? We've invested for a number of years for things like teledetailing and virtual engagement is the space that we call it. How much does that need to expand? Does the partnerships that we can create now with telehealth providers perhaps help with some patients who would otherwise not be able to get the access to the medications that they are needing? Other opportunities to create distribution channels for potentially COVID testing, antibody testing. All of these are aspects that are possible for us to look at. I don't want to say that it is an easy thing for us to do, because my friends over at the IT area would probably kill me if they said that. But the reality is we are far more able to be nimble in that way than a lot of other organizations are, and we have real can-do people who will make that happen. So flexibility, seeing where it makes sense to expand the services to provide value to our clients is key.
To that end, some of the conversations that you're having with clients and partners nowadays, how has the tenor changed? How can maybe in organizations that are a little bit less nimble than TrialCard, what advice can you pass along? What help can you offer?
Partly, and this is probably a little bit of my bias, because as you know, Larry, I'm a data guy by background and a public health guy, and that's what my training is in. So I think about so much of what we're doing right now as keeping our eyes focused on where the data is leading us. We need to understand where trends may be emerging from, and to use the term that has been bandied about before, finding that signal within the noise. Right. That becomes ever more important for an organization like TrialCard. So if we can work with our individual pharma clients and prospectively alert them to where we're seeing drops in activity happening. Is it happening in certain locations versus other locations? I mean, I'll give you an example. We were doing some analysis of what was happening in terms of the number of redemptions that were going through in sort of from month to month. So thinking about how much change did we see from January to February, and February to March, and March to April, and we were comparing it to years in the past. And what we were able to see was that the speed at which the coronavirus outbreak was occurring was having a significant impact on when you saw significant downturns in volume. And so we saw that happening in very high volume in states. But what we were also able to see is that we are having an impact even on less affected states. And that's a pretty interesting type of finding. What it says is that the general zeitgeist of this coronavirus is national in nature. So even though individual states, like West Virginia, North Dakota, Maine, that, up through April were having a relatively minor outbreak as far as this goes, we're responding almost the same way as some of those states in like New York, Connecticut, and New Jersey. That's an important finding, because it says you have to pay attention to these high volume states, but don't forget about the low volume ones too, because they may also be affected. That's the kind of insight that we're really focused on making sure that our clients understand.
That's a great point, and I think it's one that's been a little bit forgotten amid all of the noise over the last couple of months. Paul, I want to throw one more question at you, and then we'll open up the broadcast to some viewer questions. We talked about it. I think the way you described it was this ugly period. It's going to last obviously a little bit longer, both for TrialCard, for the industry, and especially for patients. What are some of the wild cards that you're going to be watching in the months ahead? What are some of the issues that can kind of turn this a little bit towards the better or a little bit towards the worse?
Yeah, I think the brutal truth of this is that the virus operates on its own, and it has its own logic, and so it's going to follow a pattern that is its own, and to a large degree, it's going to be very difficult for us to affect that. I think as I think about sort of the most salient pieces that we can see is where do we see an upturn in the near term in numbers of cases because of reopenings? That is right now, I think, the biggest question mark. I was looking at some of the data recently for 3 of the states that have opened most recently, and yet still had 2 weeks of runoff, so that we could see whether there was a spike in cases. And this included, Georgia, South Carolina, and Alaska. And the good news is it didn't seem like cases had gone up. The bad news is it seemed like deaths had gone up. Now, it was very, very early in looking at this data, so it's very hard to make a conclusion that we're seeing something that is certain in these data. And as more and more states continue to open, we will have more data that will allow us to get a better sense of what's going on. What we've heard anecdotally is that even in some of the states that have reopened, even though businesses may be more available now, people are not necessarily taking advantage of it and being as active. So what that means is it may take longer than what we were sort of assuming. The assumption was you open things back up, you check after 2 weeks, you see if there's a change, and then you feel like you know what's happening. The reality is it may take more than 2 weeks for consumers, for people to feel comfortable enough to frequent some of the newly reopened businesses before we can start to see whether there has been an impact in reopening. So I think, again, reopening is probably the feature that I would look at most closely right now.
All right, let's turn to a couple of questions that we have. This one is from Lisa. I apologize if I messed up the pronunciation there. Lisa writes, whether COVID exists or not, we now have 20% employment. 1 out of 5 working adults out of work. Are there any innovative ways to reach the unemployed American who may be at health risk for screening and treatment, but are either uninsured or underinsured and can't handle a copay or out of pocket for something non-emergent?
Completely agree with the questioner's perspective here. It is a real crisis that we are now facing, or 20 or 25% of the people in the United States are now facing. Some of those scary numbers that I think we've all heard before about a significant portion of the United States population not being able to handle an unexpected bill of $400 is a very worrisome type of event. You add something like this onto it, where you're getting massive disruption, especially for people who are working in the services sector, and it becomes a real crisis. Now, fortunately, pharma companies have been really good with their patient assistance programs. And these need-based programs, I think, really do provide that kind of safety net for a lot of patients who might not have any other options to look at. What I wouldn't be surprised to start seeing is if some of our manufacturers decided to invest a little bit more heavily in things like vouchers for certain types of products, to lower copay values down to lower levels, in order to make sure that patients have the ability to get these medications that they need. So it's a real issue, and it's something that fortunately there is kind of an ultimate safety net there, but it is certainly something that could rapidly overstress the entire system. So it's very significant risk.
Yeah, which is terrifying in itself, given how much stress
Agreed.
already. All right. One last question for you. This comes from Janet Pillow. Janet asks, how are you leveraging technology, Mango or otherwise, with copay for buy a bill products? What game-changing technology are you looking for the buy bill space?
Buy and bill and is going to be a key aspect of how we're going to help with Mango. So Mango and our approach for adapting it for the world of specialty products is going to still be able to provide the type of access point for patients so that they can get materials that we know that our pharma clients want patients to be able to see. They need patient education. They need the ability to have, for example, injection training. If there's the ability to see videos on this application, that is also now a real opportunity through Mango. So again, I completely agree with the questioner, and we are really seeing Mango as kind of in the forefront. I think I described it earlier as thinking about Mango as kind of this communicator, this access tool in the broadest sense of what access means, not just product access, not just insurance access, but access to all the information that a patient may need about the care that he or she's receiving. That's how we're thinking about this. And so, yes, technology is a crucial part of this.
Right. Paul, we can't thank you enough for your time here today. This is a terrific education for me and hopefully everybody else who's tuned in. I want to thank you, and I want to thank TrialCard for sponsoring today's session. And this was a terrific discussion. At 1:35, we're going to have our last session of the day, which is a discussion on employee engagement and corporate image, featuring MM&M's editor-in-chief, Steve Madden. He's going to be speaking with Chris Geyer of Paro AI. So please stick around for that. And you do so by scrolling down to the bottom of your screen and clicking on session 3. Paul, thanks again. Went really well. Really enjoyed this. And be well. And everybody who's watching, thank you for tuning in.
Take care, Larry.
You too.